Hello everybody, my name is Bailey, and today we're going to be learning about chlamydia for my pathogen presentation. Chlamydia is caused by the bacteria Chlamydia trachomatis. It is classified as a gram-negative, coxoid, or rod-shaped, obligate aerobe, and non-motile. Virulence factors include the polymorphic outer membrane autotransporter family of proteins, the putative large cytotoxin, type 3 secretion effectors, stress response proteins, and other regulatory factors and proteins produced by the cryptic plasmid. The three strains involved in human illness are Chlamydia trachomatis, Chlamydia psittaci, and Chlamydia pneumoniae. Chlamydia is transmitted through direct contact with infected tissue and spreads through vaginal, anal, or oral sex with someone infected. Chlamydia can also be given to a baby during childbirth by the mother. Chlamydia infections are the most commonly reported bacterial infections in the U.S. and the most common case of sexually transmitted infections worldwide. Chlamydia trachomatis has a distinct life cycle consisting of two major phases. The first phase is small elementary bodies that attach and penetrate cells. By doing so, they change into a metabolically active form called the reticulate body within 6 to 8 hours. These forms create large inclusions within cells. The second phase is the reticulate bodies then reorganize into small elementary bodies, and within 2 to 3 days, the cell ruptures. This rupture releases the newly formed elementary bodies and initiates the replicative process. This is the form that can infect new epithelial cells. Because of this long growth cycle, treatments with agents with long half-lives or prolonged antibiotics are necessary to eradicate the infection. In females, the cervix is the most commonly infected site. Females may also have an infection of the urethra. If left untreated, the cervical infection can ascend into the upper genital tract and cause pelvic inflammatory disease, infertility, and chronic pain. Pregnant women with Chlamydia trachomatis are at high risk for complications. The most common symptom in males are urethritis, epididymitis, and prostatitis. Urethritis typically presents with a mucoid or watery urethral discharge, and dysuria is often included with this. Epididymitis usually has unilateral testicular tenderness, pain, and testicular swelling. Prostatitis symptoms are typically present in dysuria, urinary dysfunction, pelvic pain, and pain with ejaculation. Symptoms for women also include vaginal discharge, itching in the vaginal area, and bleeding between periods. Symptoms for males can also include painful sexual intercourse and rectal pain. Chlamydia trachomatis is the most commonly reported bacterial infection in the United States. In 2021, 1,644,416 cases of Chlamydia trachomatis infections were reported to the CDC, making it the most common notifiable sexually transmitted infection in the United States for that year. Rates of reported cases are highest among young adults in the age group of 15 to 24 years. The rate of infection among females has remained much higher than among males. Females are believed to be more likely to be screened than males. Race, ethnicity, and region also play a role in rates of infection. Chlamydial infections are disproportionately higher among persons in certain racial and ethnic groups. Some factors that may contribute to such inequities include differential access to quality healthcare, social and economic conditions, higher prevalence of disease in sexual networks, and differences in immunogenetic determinants that influence the immune response to chlamydia. Another key epidemiological feature is based on region and state. The South has consistently had the highest rate of chlamydial infections. The 5 states with the highest rates recorded in 2020 were Mississippi, Louisiana, Alaska, South Carolina, and North Carolina. The morbidity of this infection for women usually includes cervicitis, urethritis, pelvic inflammatory disease, and perihepatitis. For men, it's usually epididymitis and urethritis. Some can be seen in both men and women and include oropharyngeal infection, rectal infection, and reactive arthritis. The morbidity for infants and children is usually conjunctivitis, pneumonia, trachoma, and urogenital infection. Chlamydia infections are not commonly reported as a cause of death, but they can cause ectopic pregnancy, and if left untreated, they can lead to significant internal bleeding and death. Chlamydia trachomatis is an obligate intercellular pathogen. Humans are the only natural host. They cannot survive outside of the eukaryotic host. Chlamydia trachomatis is transmitted from person to person via vaginal, anal, or oral sex with someone with the infection. It can also be transmitted from mother to infant via the infant's contact with the mother's genital tract during birth. The only way to completely avoid chlamydia is to not have vaginal, anal, or oral sex. Another option is being in a long-term, mutually monogamous relationship with a partner who has been tested and does not have chlamydia. The recommended treatment for non-pregnant adolescents and adults is doxycycline 100 mg orally twice daily for 7 days. The recommended treatment for pregnant women is azithromycin 1 gram orally in a single dose. After completing therapy, a routine test of cure is done approximately 3 months after receiving treatment due to a substantial risk of a reinfection during those 3 months and the chances of receiving false positive test results. Anyone diagnosed with this infection must contact all sex partners with whom they had sexual contact during the 60 days preceding the onset of symptoms or diagnosis and should be referred for evaluation, testing, and treatment. Azithromycin is recommended for infants born to mothers with chlamydial infection. Children older than 8 should be treated with azithromycin. There are no vaccines, and anyone who has had an infection and was treated for it in the past can get the infection again. The selection of a laboratory test to detect the presence of Chlamydia trachomatis is a critical component of disease management and prevention. Nucleic acid amplification tests are the preferred testing method because they amplify nucleic acid sequences specific to the detected organism. There are multiple of these tests available for diagnostic testing, which include urine specimens for men and women, urethral secretions in men, and endocervical swabs in women. Some tests are cleared for vaginal swabs as well. Some other tests include non-amplification molecular tests, culture, and serology. In newborns that are suspected to have received the infection from their mother, it is recommended to use direct fluorescent antibody to test for it. For children suspected of sexual abuse, only clinical laboratory improvement amendment validated FDA-cleared nucleic acid amplification tests should be used in the setting. All initial positive tests require confirmatory testing. Other tests are not recommended in this setting because of poor specificity. There is a research that supports a new vaccine that shows the potential to protect people against genital chlamydia effectively. This potential vaccine is the first found to be safe and spark an immune response. Considering chlamydia is the most common notifiable sexually transmitted infection in the United States, experts have been looking for a safe, effective vaccine that offers long-term protection against chlamydia. This could be a promising vaccine to protect people against genital chlamydia effectively. Here are my references, and this is the end of my presentation, and I hope you all enjoyed learning about chlamydia.